Feeling trapped by outdated cancer treatments? You're not alone. Welcome to Off-ScriptRX, where we break free from the limits of conventional medicine and open the door to revolutionary repurposed medications. I'm Dr. Nathan Goodyear, and this podcast is about disrupting the cancer care status quo. It's time to reclaim your health with treatments they don't want you to know about. If you're ready for a future of real possibilities, you're in the right place. Rethink repurposed medications. Rethink reality. Can an aspirin a day keep cancer away? You know, the old saying is, can an apple a day keep the doctor away? But here in the world of repurposed medications on Off-ScriptRX podcast, the question is, can repurposed medication like aspirin keep cancer away? Welcome back to the Off-ScriptRX podcast. And today we're going to be talking about repurposed medication that is aspirin. Now, when we talk about repurposed medication, just always like to recap this. You know, originally it was repositioning, but here it's the repurpose of a medication originally approved FDA for one indication, or in some cases, multiple indications. And then through ongoing clinical utilization, observation, it starts to get into preclinical and other areas where, man, we might be able to use this in another area. So we might be able to take a medication that's been purposed and approved by the FDA and repurpose it to go over here and work in, say, cardiovascular disease, autoimmune disease, angina, but maybe here, cancer. So it's not really going through the FDA 1, 2, 3 phases of approval, because here it's already done that for its FDA approval. But the phase 1 and phase 2 of the FDA approval process, a lot of that looks at the safety. And that's one of the benefits of the repurposed medication movement is on all these medications, the safety profile, the data on the safety, because of its long-term utilization of many different medications, it's well known. That doesn't mean they're without risk. No. It just means that the information is well known as it relates to toxicity, side effects. So it's been proven to be safe over time. Makes me think of something here recently of an injection that was given that hadn't been proven to be safe over time, yet we use that. So when you look at the repurposed medications, it relates to that. Repurposed medications are actually following more the scientific method to provide patient safety, but improved efficacy. Now, aspirin is salicylic acid. Okay, so the benefits here of aspirin is, notice it's not a prescription medication. It's over the counter. So when we talk about repurposed medications, we think, okay, this is going to require a prescription, go to my doctor. But here, this one, you can just get it over the counter. Just go down to your local pharmacy, Walmart, you take your pick and purchase it right there. So it's easily accessible, but repurposed medications can also be supplements, nutraceuticals, and I've talked about vitamin D, even did a short reel, and we'll do a post on the repurposing of a fever in hyperthermia. So the accessibility is probably one of the key aspects of repurposed medication. Number 2 is cost. Not having to go through that phase 1, phase 2, phase 3 study phase where it takes about, in the oncology world, about $2 to $3 billion in 10 to 15 years. Don't have to go through all that. So all that cost accumulation, accumulation of cost doesn't get passed on to the consumer through the company that had to invest in that. So it saves cost. Then, as I mentioned, there's a long track record of these repurposed medications of safety because they've already gone through the phase 1, phase 2, phase 3 profile testing as it relates to FDA approval. And that phase 1, phase 2, again, was safety. So long safety track record. And as I mentioned, it doesn't just require prescription. This aspirin, it's available over the counter. When we look at chemotherapy, for example, radiation, surgery, they have very distinct direct effects. Surgery is to cut out. Chemotherapy directly destroy rapidly dividing cells. And radiation also is to destroy rapidly dividing cells. But here with repurposed medications, they're interfering with signaling pathways, affecting inflammation, immunomodulation, metabolism. So they're working all over the place simultaneously. So instead of this, big rock and throwing it in the mud, we're actually taking a pebble, throwing in a rock and letting it ripple through the body, the cells, as it relates to interacting and interfering in many different aspects as it relates to the cancer. Now, obviously, repurposed medications are not without side effects, and we'll touch on that in just a second, but just know that the mechanisms of action here are not basically cause and effect as it would be related to chemotherapy, radiation, or surgery, but here it's much more of a ripple effect, affecting multiple areas simultaneously. And again, there's such a growing interest in the repurposed medications because you're bypassing all that FDA approval process, cost, long-term safety track record, and then it can be augmenting conventional treatment strategy or integrative cancer treatments as well. And of course, I've already talked about how repurposed medications are really being advanced in the area of oncology because of these keen interests. But there's definitely pushback related to this because clearly there's a lack of control. And what I mean by that is a lack of regulation and control of how people think, how people practice. Not control in terms of safety, or of potential harm to patients, but most it's controlling the flow of patient care, controlling as a result the flow of patient profitability. Because when you open that doorway of repurposed medications, it empowers patients. It empowers doctors to help patients, not individually, but also to augment what's happening. And some people just don't like change, for sure. So let's look at the context of aspirin. Follow the story of how aspirin came to be that it is today. Started off as an anti-inflammatory, a pain reliever. And this was primarily going way back. And it was epidemiology studies that started to link aspirin to reducing cancer risk, particularly looking at colorectal cancer. And some of the pioneer first studies were done by researchers like Dr. Peter Rothwell. And he found that aspirin's anti-inflammatory effects actually reduce the incidence of certain cancers, and such as colorectal cancer, and actually improve. So not just reducing the risk, preventing, but actually improving survival. Get that, improving survival. So the salicylates, which is where aspirin comes from, it's been derived from willow tree bark. So that's where it comes from. It's actually originating from a natural source, as so many of these therapeutics do. Comes from ancient use, goes all the way back to the indigenous ancient Babylonians, the Sumerians. They would actually use this for pain management. And Hippocrates, who was considered the father of Western medicine, he would use it for pain management and fever control. He even used and brewed a tea of salicylates, and he would use that for pain during labor. So this use goes way back. In 1763, a clinical trial, the first of its kind by Reverend Edward Stone, a pastor, he studied the effects of willow bark powder in the treatment of fever. About 100 years later, the effects of the willow bark powder was studied in acute rheumatism. Now here, that's like rheumatoid arthritis. 1828, Professor John Buckner, he used salicin, and he used this again in fever. Henry Leroux used it in the treatment of rheumatism, again, rheumatoid arthritis, in 1829. So you can see this original use was in fever, pain, inflammation reduction. Then in 1800s, started to get into the industrialization of the product rather than just getting it from the willow tree bark. This was the Hayden, Heyden chemical company, mass-produced the salicylic acid commercially. Now, it wasn't known as aspirin at that time, but it was commercially produced. And it wasn't until 1899 when it actually was registered and marketed by the trade name aspirin by the company Bayer. So 1899, and here it is 2024. We're going a long way back. Now, it's interesting how far back the history goes of knowing pain, fever, inflammation, but its mode of action wasn't really begun to discover until the 1970s. So this ongoing issue of understanding exactly how it's being used as an anti-inflammatory in pain and fever, it wasn't known until about 50 years ago, but yet it's been used for thousands of years. Not as aspirin, but as its original willow tea bark. Now, the FDA approval process, as we've mentioned, it's very approved, and it wasn't until the 1920s, 1930s when the FDA started to really get into this approval process with drugs. But here, aspirin originally was not FDA approved. It was actually what's called grandfathered in. So, because in 1899, when it became known as aspirin, the FDA itself as an entity did not exist. Now, originally it was a prescription drug. And so instead of going all the way back through the FDA approval process at that time, they came up with this concept of grandfathering it in, which these were accepted, safe, proven therapies. And so they would just, approve them as if they had gone through the process, but they were grandfathered in. Now, currently, aspirin is FDA approved for 3 primary indications. The first is the prevention of myocardial infarction, that is a heart attack. And this is using aspirin in those at high risk for cardiovascular events, that's what an MI is, by inhibiting platelet aggregation. Obviously, platelets clot. There's many other aspects of what they do. And so this would help to prevent a blood clot or a clot in the vessel leading to the heart and thus leading to a cardiovascular event. Also, in those at high risk for stroke, so those with transient ischemic attacks, that's TIAs, that aspirin can be used for the prevention of strokes. Again, high-risk individuals, myocardial infarction or stroke. Both cardiovascular events, different location, one heart, one brain. But then also indicated for use in cardiovascular procedures such as in coronary artery bypass grafting or CABG to reduce complications. So you can see aspirin here really being used, approved, and used in prevention strategies in those for high risk. There are many off-label utilizations of aspirin that are employed, and in fact, cancer and prevention of cancer are 2 such indications where it is being used off-label. Now, I think most people are aware of the dosing of aspirin. Most of what you're going to find over the counter is really kind of 2 doses, really 3 doses. One is the baby aspirin, that's 81 milligrams. Second is aspirin in 325 milligrams, and then there's 500 milligrams. There are delayed forms of it. There's chewable, there's suppository forms, and there's even IV forms. So again, what we want to focus on here is the research that points to the repurposing of a medication. And here we're talking about what used to be a prescribed medication, but is now an over-the-counter. So the research, the volume of research, the type of research, again, it originally began with preclinical research that is, non-human. And we're talking about in vivo, in vitro. And this progressed to human clinical research. And of course, animals were involved in this. And there have been numerous studies on aspirin in humans in cancer that have been both published and are ongoing. Now, the problems with these studies is that they're going to be limited in size. They're going to be limited in funding because, aspirin doesn't have a patent to it. And so with that, you're not going to be able to get these huge ongoing studies because these huge ongoing studies cost massive amounts of money. As I mentioned, new oncological medications on average cost about $2 to $3 billion going through the FDA approval process. And again, this is one of the advantages of this. So really getting these kind of large, huge, or getting a new indication for aspirin in cancer, it's just, unlikely to happen because of that cost investment. So when we look at some of these studies, let's just go through a few of them so you can see just some of it. And of course, check out in the show notes the studies, they'll be listed there. One study, 2003, New England Journal of Medicine, looking at aspirin to prevent colorectal adenomas. A 2013 study looking at alternate, so not every day, but alternate low-dose aspirin in cancer and looking at it long-term in place of risk. So what's that alternating aspirin long-term? What's its implication in risk? Then in 2012, looking at daily aspirin on the risk of preventing cancer spread. That's cancer metastasis. 2009, aspirin in cancer prevention. You're going to see a lot of the studies are in cancer and prevention. And then looking at effective daily aspirin on long-term risk of death in cancer. 2011 Lancet. So mainstream, big journals. But most of the aspirin studies are in prevention, but some of these aspirin studies in humans are actually looking at treatment or long-term risk, long-term survival, which is what it's all about. Now, there are several ongoing aspirin trials in human studies, one looking at HER2-negative breast cancer. It's called the ABC trial. One looking at Barrett's metaplasia trial in combination with esomeprazole, chemoprevention. Another one looking at aspirin on disease recurrence and survival after the primary treatment in common non-metastatic solid tumors. Looking at its treatment in colorectal cancers, and then just looking aspirin and cancer overall in older individuals. Again, check out the show notes for these indications and references, but you'll also be able to find links out to these clinical trials. Not sure if they're still recruiting, but check those out because there actually may even be new ongoing clinical trials going that you could be accessed to. But remember, aspirin is over the counter. But I always encourage you to connect yourself, associate yourself with a practitioner that has full working knowledge as it relates to repurposed medications for the indication of cancer or for the indication for which you're seeking its aid. So let's look at the mechanisms of action as it correlates with cancer and aging, because I've talked before and I talk a lot about the hallmarks of aging and the hallmarks of cancer. And what's interesting about these two hallmarks, aging and cancer, is that there's massive overlap between these two. So when we look at the mechanisms of action in cancer, some of its primary mechanisms is through its anti-inflammatory, but primary it's cyclooxygenase enzyme inhibition. And about 90% of the COX inhibition, these enzymes are inhibited by the administration of just 160 to 325 milligrams. And it lasts for about 7 to 10 days. So it doesn't take a lot of aspirin to really inhibit 90% of these enzymes that really propagate a lot of the inflammation associated with cancer, that promotes tumor growth, invasion, and the spread, that's metastasis. But also aspirin inhibits platelet aggregation around circulating tumor cells. So it doesn't just have an impact on cancer invading and growing that way. It's also negatively impacting the ability of platelets to surround circulating tumor cells that are released from the primary tumor. I just talked about biopsies as it relates to breast cancer and metastatic risk or overall survival. So check that out, because you can just simply manipulate a tumor in surgery and you increase circulating tumor cells. But here, circulating tumor cells, I think a lot of people think about those as they are released from a primary tumor. They don't exist in isolation. They take an entourage with them. And here these circulating tumor cells will surround themselves with platelets. And there's several advantages that it has with that. One is it protects it against the immune system. So it provides a buffer against the immune system. It protects it against shear forces. And then it also helps to aid it to land at a distant site to form a distant metastatic site, and that process through intravasation. Now, when we look at the hallmarks of aging, primarily the two impacts there are inflammation and genomic instability. Now, inflammation, you can see that's a common thread between the hallmarks of cancer and hallmarks of aging, but you reduce inflammation, that's kind of the bed, not that just which cancer exists in, but also that which chronic disease, take your pick, exist in. Now, genomic instability, that's interesting because a lot of overlap with genomic instability in cancer, because when you look at cancer and its rapid replication rate, there's a lot of genomic instability there also. And that's where you get all these mutations. So, when we look at the hallmarks of aging, we're seeing its primary impacts on inflammation and genomic instability. But when we look at the indication for cardiovascular prevention and pain relief, it's over the counter, 325, 500 milligrams used as needed. But in the off-label use of cancer prevention, the dose is actually much lower because it's an ongoing preventative strategy. And the dosing there is typically much lower at about 75 to 100 milligrams. And that's where that daily aspirin comes in at 81 milligrams. So if you're looking at aspirin from a preventative strategy, the dosing is going to be very different from an ongoing treatment, say to prevent invasion or metastatic risk. So again, find a doctor, work with a practitioner that has a full working knowledge of risks, side effects, how to follow with these repurposed medications. And here we're talking about aspirin. So what are the side effects of aspirin? Toxicity, because I did mention that the reason why aspirin and other repurposed medications are so advantageous is their turnaround time and their long safety track record. But that doesn't mean they're without side effects. Common side effects associated with aspirin are primary gastrointestinal, also bleeding, and maybe some ulceration. Very rare that this happens, but it's nonetheless risk. It is a risk, so be aware of aspirin use. If you have a diagnosed ulceration, you're at risk or have had history of gastrointestinal bleeding, and always, again, consult your doctor. But other more severe adverse events could be hypersensitivities or allergic reaction, only about 1% to 2% there. Ray's syndrome, which is a form of encephalopathy, using this in fever, and then intracerebral hemorrhage because of its inhibition of platelet aggregation. Now, with any repurposed medication, you shouldn't just give repurposed medication and just never follow the individual, because what we never know is exactly how each individual and each individual's body will respond to the therapy that we administer. And here, again, repurposed medication. So with anybody that's on aspirin for the treatment of cancer, really needs to have ongoing, regular, but not very frequent evaluation of liver function tests, kidney function tests. So again, practitioner that knows what to do, how to follow, how to dose, and how to use the science to treat cancer through repurposed medications or prevention is very much advantageous for you. So it requires some simple laboratory monitoring, but make sure that that's done. But what are the specific anti-cancer mechanisms of aspirin? Because that's really what we want to know. And understand, when we look at the research here, the research points to the mechanism or mechanisms, but what you're also going to see is the verbiage that always says more studies are indicated. And you're never going to see definitive statements here because it's not FDA approved for that process. So it's going to be more, look what it does in this study. And that's what we have to recognize when we talk through the research here, the positive nature of what it's showing as it works in these specific mechanisms of action, but also what are the limitations of the research. And there's no perfect study and there's no perfect therapy. With every positive benefit or positive research, there's a negative or limitations therein. So the first is going to be the inhibition of the pro-inflammatory pathways. And that's going to be primarily here aspirin through the COX-2 cyclooxygenase type 2 enzyme suppression. Now, what's important about this is many solid tumors upregulate COX-2, and this plays an important role, this enzyme, in invasion and metastatic spread, and primarily does a lot through disruption of the inflammatory signaling. And when you look at what aspirin does, is it comes in and actually inhibits this process. Moreover, this also impacts the ability of the cancer to evade the immune system and actually meet its metabolic demand through angiogenesis. And we'll talk more about this in a second. Another type of cyclooxygenase, there's two types, cyclooxygenase 1 and type 2. There's COX-1, COX-2. So I just talked about COX-2 as it relates to inflammation. But cyclooxygenase type 1, which, by the way, aspirin also inhibits, so it's a non-specific COX inhibitor, so COX-1, COX-2, it actually inhibits platelet aggregation. And that's COX-1 actually upregulates platelet aggregation. So here, aspirin is going to prevent that blood clotting, and here's its benefit in those at high risk for cardiovascular disease and stroke, etc. And again, what it's doing, you have to understand what cancer does is it requires platelets. And these are called cancer platelet cell aggregates. Now, they even add in what's called neutrophil extracellular traps. But as I mentioned, it's this just conglomerate of cells circulating through there. And so aspirin actually can target the means of metastasis through the mechanisms of inhibiting that platelet aggregation, which aggregates around the cancer cells, preventing the immune system from getting to it, also protecting against the sheer force of the blood, and so thus disabling or limiting its ability to bind to a distant site and intravasate and form a metastatic site. So it disrupts this cloaking that allows a cancer cell aggregate to evade the immune system. And thus it's going to negatively impact its risk, its potential for metastatic spread. Now, nothing's perfect in preventing the metastatic risk, but it's important to do what we can in a safe manner, because 90% of morbidity and mortality with cancer is associated with it spreading. That's metastasis. So if an aspirin can actually limit, so if somebody's diagnosed with stage 1 or stage 2 cancer, and then putting them on something as simple as an aspirin, and that can reduce the risk of it spreading, the benefits far outweigh the risk. But again, it can negatively impact your platelets. So again, you'll need to talk with your doctors, because there can be a lot of interaction with some other the medications that you may or may not get put on as a patient with cancer. Obviously, it's working within the immune system, but it's modulating the immune system. And one of the things that's happening within the tumor microenvironment is, as the cancer brings the immune system to it and it adulterates the immune system, because remember, cancer creates nothing anew. It just adulterates and alters that which is there already existing for its benefit and the detriment of the body. And so what it does is it draws immune cells to them, it alters them, and this then creates an immunosuppressive environment within the tumor microenvironment. So it's almost like it's an autoimmune-esque type of process, that the immune system gets turned on the immune system. So what aspirin can actually do is it can actually modulate the immune system and reduce this immunosuppressive environment that exists within the tumor microenvironment. And in some aspects, this is called a cold tumor. It's a tumor that doesn't necessarily respond well to immunotherapy or the immune system, because anything that is a therapeutic affecting the immune system is an immunotherapy. But so aspirin could almost be thought of in a means of making a non-responsive tumor to immune therapy to one that could be. Now, research hasn't really looked at that, but it's just some food for thought, because how it's working within that tumor microenvironment. Beyond the immunosuppressive impact as immunomodulator, it's actually specifically increasing the reactivity of the innate immune system to cancer. Because if we can unmask that cloaking device and remove that immunosuppression and upregulate T cells and natural killer cells, we can actually increase the direct innate immune attack on cancer cells. And that's exactly what aspirin can do. So it works in a multitude of ways within the immune system. Aspirin can induce apoptosis. This is programmed cell death. And it can do this in certain cancer types. Now, the research on this is limited, but it definitely has been shown to be a potential where aspirin can reactivate the pathways that get turned off. Because understand that what apoptosis is, it is a protective mechanism. If a group of abnormal cells exist and these cells recognize that they're abnormal, there can be upregulation of signaling, and even the immune system can come along and say, you're not normal. These cells can say, I'm not normal. And they can then trigger this programmed cell death, this activation, this death signal, this countdown, boom, it's triggered, and then it dies. But cancer goes, well, that's not good. I don't like that, because I like to grow unregulated. So something that can trigger a programmed cell death signal, I want to turn off. And so that's exactly what cancer does. But aspirin can come back and turn that back on, and thus allow the ability for that inherent programmed cell death signaling to be reactivated and promote cancer cell death. Primarily they're talking about capsase activation, But even some of what cancer will produce is it'll produce anti-apoptotic signals, and aspirin can inhibit that. I talked about angiogenesis. This is the blood vessel supply growth that cancer so desperately needs, because as cancer cells are replicating rapidly, the tumor's growing, it has to have a supply of nutrients, of blood, to be able to meet that high metabolic demand of that metabolic rate. It also needs to remove waste, and that process is called angiogenesis, neogenesis. And so that's two aspects. But what happens is that tumor is growing, outgrowing its vascular supply. It becomes hypoxic, that environment, and starts to signal very erratic blood vessel supply growth, and that's called angiogenesis. COX-2 is intimately involved there, and aspirin, again, already mentioned that, inhibits COX-2, but I talked about that up in inflammation. But understand that's also impacting angiogenesis here. And thus, by reducing that nutrient supply, so basically think about it like a gas pump. If you take that out of order, so there's no ability to fuel the cancer because the pump is not there. It's not the fuel, it's the pump, it's the delivery, that's the blood vessels. Then what you're going to do is you're going to limit tumor growth. You're going to restrict tumor growth. And that in turn, when you block angiogenesis, you're going to increase the susceptibility of the tumors to treatment, to other therapeutics like chemotherapy and radiation. And that's why you see Avastin, which is an anti-angiogenic therapeutic from a conventional standpoint, being used with these other therapies like chemotherapy. Aspirin will potentially, it'll block DNA repair mechanisms, and it has genomic stability effects. Because when we look at cancer, it's constantly mutating, and it likes to impair repair. And aspirin can impair that repair inhibition process. And also the rapid mutation creates genomic instability. Again, the analogy I'll use is the tires blow the axials on the car on the ground. As the faster you go, as you push the gas down on the floor of the car, the gas pedal, what happens is that metal on the concrete or on the road, it generates sparks. That's mutability. The faster you go, the more mutations that go. And so that's the genomic instability that's inherent to cancer. But the more rapid the tumor growth is, the more genomic instability there is. And that's where you get all these mutations and where cancer becomes very difficult to treat. But again, you can see cancer doesn't like the repair of that process, because that mutability gives it adaptability, gets it malleability, which allows it to go, wow, look, I got this mutation here. It provides me an advantage here. Not a conscious, but it's just a reaction where it now can evade the immune system, or it can actually invade, or it can actually, form a new distant site. So aspirin can really work to impact positively DNA repair and thus reduce the genomic instability present that is common in cancer. So that's just the mechanisms of action, looking at aspirin and how the research points to its need to be repurposed potentially as a repurposed medication. But I would say the evidence is very strong on aspirin as a therapeutic, but also when you look at cancer treatments, cancer wasn't caused by one thing, and cancer treatment can't occur through one thing. So looking at aspirin as a repurposed medication, combining it with other therapeutics, is going to be where, as all therapies, shine. So surgery, we know that pre and post-surgical aspirin can be used to prevent metastasis by inhibiting platelet aggregation. What do we know about surgery? Well, I already talked about surgical manipulation, increasing circulating tumor cells, and that's exactly what we're talking about. Surgery increases circulating tumor cells, and understand this can last for weeks. One study I talked about over the biopsy and cancer spread, so check that podcast out over at off-scriptrx.com. But there you can find in that study, they talked about the manipulation increasing circulating tumor cells. Well, if we take pre and post aspirin from surgery, then we can limit the impact by eliminating or blocking platelet aggregation around those circulating tumor cells. And one of the studies I talked about in that other podcast was that the circulating tumor cells are increased because of that surgical manipulation, and it can last for over 6 weeks. 6 weeks. So that's surgery. Aspirin and chemotherapy can enhance the effectiveness by making cancers more vulnerable. I talked specifically about that related to angiogenesis. Again, we block that blood vessel supply growth, block the fuel supply. It's going to make it more vulnerable to chemotherapy and radiation. That's exactly what happens. So chemotherapy, radiation, primarily the same mechanisms. Immunotherapy, well, aspirin's working within the immune system. If you can reduce the immunosuppression within the tumor microenvironment, guess what? That's going to aid immunotherapy. If you can augment T cells and natural killer cells, guess what that's going to do? That's going to improve any other immunotherapy you augment. Now, when you look at targeted medicines, there's less information as it relates to aspirin plus targeted medications. But one caveat I would provide here is that aspirin use in conjunction with medications that are not necessarily targeted with cancer, but targeted as anticoagulants, such as Eliquis, heparin, warfarin. So any of these type of anticoagulants or blood thinners that more often than not, cancer patients at one time or another will be on, aspirin can increase the adverse events associated with bleeding in combination with those. So if you're on any type of medication, I think it's always advantageous to you as the patient to be honest with your doctor, your lead doctor, about what supplements, what off-label, what off-targeted over-the-counter medications you may be using, because they may have a positive impact on what they're doing and they might be able to lower the dose, or it could have a potential side effect. So be honest. If they don't know, then work with them to help them know, or find a doctor that can work with them to help them know as well. Woo. So repurposed medications. It's not just about a prescription. It can be about an over-the-counter therapeutic like aspirin. But the dose varies, the indication varies, the treatment purpose varies. But what's important is that you find a doctor that knows how and when and where to apply these therapeutics, something like aspirin, to help you to achieve the results you want in the targeted way that you need and in the low side effect profile that I think all desire. Cancer prevention, low dose baby aspirin, perfect. But when you're looking at cancer treatment, seek out that doctor that can help guide you in the safest, most direct, targeted way. So I hope this podcast has been helpful to you. That's a wrap on this podcast of aspirin as a repurposed medication in cancer. So let me get back to how I start off. Can an aspirin a day keep cancer away? Well, there's definitely evidence that points to certain cancers that the answer is more likely than not, yes. Now, cancer is a complex disease, but when you look at colorectal cancers, aspirin a day could keep cancer away. That's a wrap on this podcast on aspirin as a repurposed medication movement. For more information on repurposed medication, I encourage you to go over to off-scriptrx.com, where you can engage, discover, empower yourself, and force multiply this movement of repurposed therapies, here, repurposed medications, even over-the-counter supplements. I encourage you to subscribe to this podcast, download this podcast, give us a 5-star review. We would appreciate it. And share, like, and subscribe this podcast and the website to those loved ones, family members, or others that can benefit from this information. Look forward to seeing you on our next Off-ScriptRX podcast. Your health deserves more than a one-size-fits-all approach. Subscribe now and share this episode to help others break away from outdated treatments. Visit Off-ScriptRx.com to see how repurposed medications can fit into your personal cancer care strategy. Don't settle. Take action and join the movement to rewrite the future of medicine. Rethink repurposing medications. Rethink reality.